Hello, I'm Lindsay. I'm your German nursing student for the afternoon. I'm closing the door to provide patient privacy and washing my hands. Would you please confirm your name and date of birth for me?
My name is Carol Winters, and my birthday is January 6th, 2000.
Very good, thank you. I'm here to do a postpartum assessment on you. Is that okay?
Yes.
All right, it should take about 10 minutes.
Okay.
All right, I've already gotten your vital signs and I've gone over your birth history notes, but was there any birth trauma that you'd like to notify me about?
No.
All right. And was the baby born via cesarean or vaginally?
Vaginal.
All right, very good. Are you planning to breastfeed or bottle feed your baby?
Yes, breastfeed.
All right, I'm gonna put some gloves on and I'll have you take the top half of your gown down so I can examine your breasts. I would inspect the nipples and areola for any trauma, for any cracks, for any bleeding ulcers, but I see that all of that is intact and there's no abnormal drainage. I would palpate for engorgement of the nipples. It's expected not to have any at this time since we're only 4 hours after the birth, and I did not note any engorgement. Have you been able to breastfeed your baby yet?
Yes.
All right. Have you had any troubles or issues?
No, everything went okay.
Good.
Just getting used to it.
All right, we would talk to the lactation consultant if we had any issues or concerns there. So let us know if you have any questions. All right, you can go ahead and put the top back up. If you were bottle feeding, we would recommend that you wear a tight-fitting bra and that you would avoid any tactile stimulation to your breasts, movement, touching, including shower water hitting your breasts. They're very sensitive. Okay. And if you had any nipple engorgement, you could treat that with ice packs.
Okay.
All right. We would also assess for mastitis there. Now I'm going to inspect your uterus, so I'm going to take these gloves off and put new gloves on. If you would just pull up your gown for me to your umbilical region, I will place my non-dominant hand above the pubic bone and my dominant hand at the umbilicus and palpate for the uterus. It is firm and not foggy, and it is midline. If it were not midline, I would have you attempt to void in the hopes that it would return to the midline position. This can decrease our risk for hemorrhage to keep the uterus in the center. I also noted that the fundal height was at the umbilicus. We would expect it to recede 1 finger breadth every 24 hours after the birth, and it should return to normal size within about 2 weeks.
Okay, good.
All right, you can put your gown back down. Have you been able to void?
Yes.
All right. And has your rate been normal?
Yes.
Have you had any urinary retention or pain?
No.
Okay. Have you had any bowel movements or constipation?
I had a bowel movement.
Okay. And no constipation?
No.
All right. Very good. I'm going to check your perineal area next. So I'll have you lift up your gown again. There are no lacerations and no episiotomy. If there were, I would assess them for signs of redness, edema, ecchymosis, any drainage, and to see how well the edges were approximated. I would check the same thing on your C-section site if you had had a C-section. You can go ahead and put that back down. Oh, actually, sorry. I also will assess your lochia at this point. When was your pad last changed?
An hour ago.
Okay. Now, I didn't note any signs of excessive bleeding when I was palpating your uterus, and again, I see that down here, that you have only a scant amount of lochia rubra, and that is an expected finding. So you can put that back down. Thank you. Sorry for the trouble there.
It's fine.
Okay. Next, I'm going to check for your Homan sign. So if you'll relax for me, let me know if you have any pain. Any pain?
No.
Okay. And again, any pain?
No.
All right. And I'm not noting any marked warmth or redness, swelling, or difference in size between your two legs. So you're looking like you're doing very well and do not have a blood clot at this point, but let us know if you have any particular pain in your legs.
Okay.
Or one in particular.
Yeah, okay.
One-sided. Okay. Have you been able to spend a lot of time with your baby?
Oh, yes.
Good, good. You seem to be attaching well to it.
Yeah, I like her.
I noticed you're making eye contact and speaking with her very well. How are you feeling towards your baby?
Oh, I can't wait to take her home.
Oh, that's great. Do you have any history of postpartum depression?
No?
Good. Wonderful. Let us know if you start to feel any postpartum blues. We're here to help you and encourage you along your way.
Thank you.
You're welcome. Thank you. Okay. And the next thing I would do is check your blood type against your baby's blood type. If you were Rh negative and your baby Rh positive, I would administer the RhoGAM at within 72 hours of after your blood. All right, so that will conclude my inspection for right now. So if you have any questions, feel free to let me know. The call light's right there if you want to.
Thank you, nurse.
Yes.
Appreciate it.
All right, thank you.
Okay.
So much for your time, and I'm going to wash my hands and document everything and then exit.